Most people don't think of a cavernous warehouse and acres of cardboard when designing a hospital, but that's exactly how Seattle Children's started their 300,000 square foot hospital design.
The immersive nature of this whole process is amazing. It's absolutely different to have the spatial relationship, physically able to touch it and move things around.
We've been in design for the past 18 months, and we really started at the conceptual planning level to ask the question, what do we need this building to do for us?
The second phase really helps expand key services on the hospital campus like pharmacy, surgery, cancer care, clinics, and beds. It's really the new front door. The warehouse is really like an idea incubation space where all these different people can come together and focus on one thing to make a better place for healing kids. We wanted to use cardboard to give doctors, nurses, families, technicians an idea of what the space feels like. So you can literally reach your arms out and understand how big a space is and mimic what you're going to see in the real building.
It's really important to have the end users involved. The payoff there really is they do the work every day, so they really understand the nuances of what they do.
What we're standing in here right now is our future OR pharmacy satellite. We're planning for a facility about 4 times the size of what we have right now. So the ability to be in 3-dimensional space is pretty useful. And also to have the building blocks around us and say like, oh, this doesn't really work here, let's move it here, or this would be a better use of space.
Today our activities are mostly verifying and validating that our tables are the right size, that our rooms are shaped correctly. We're putting a lot of effort into thinking about future processes.
Yesterday we worked on the design of what we call the universal room, which is for the patient and family to be able to come to one place and settle in and have all of the care that they need come to them. We really focused on a plan that allowed a lot of flexibility. It allowed for families to design at least a portion of how they wanted the room to work for them.
Some of the scenarios we ran were if somebody coded in that room, everybody tested the equipment to make sure they could get what they needed to be able to help their patient.
I think it really gives perspective when we show up as parents. We can give input about what our needs are so that those can be incorporated into the building design.
The central idea is putting the patient and family in the center of care.
ZGF partners with us. They really take the role of listeners and design integrators, and they really are our partner in implementing a physical design that supports the process design.
Literally, hundreds of people help us prioritize design decisions. Back at ZGF in our office, we've got a team working to make sure that all the feedback from the nurses, the physicians, the technicians, and the families get integrated into the design. We're frequently designing and redesigning these different departments in cardboard. Selwyn really was amazing in being able to respond to things that the team wanted to build out.
Kind of joke, if I hear trace paper in the background ripping, then I know there's something coming my way. A few times it's been more than a slight change. We've brought in a bulldozer and started from scratch. If we're not changing anything, then I think the process is broke.
I think about all the kids who will be using this space in the future, and I want it to be as comfortable as it can be. It's great to be able to help shape that.
Overall, I think it's very gratifying. I think that's true for all of the folks that have been involved.
It's a physical representation of the care we give, and to be a part of that is really special.
When you think about the patients that come here, it's the biggest geographic region served by a children's hospital, so it's got a lot of responsibility. It's really a destination for healing.